If you take Metformin or any medication for your blood sugar and your hair has been thinning, I want to give you the honest version of this because the internet version is wrong in both directions. It is wrong when it tells you the drug is destroying your hair, and it is wrong when it tells you the two have nothing to do with each other. Here is what is actually true. Metformin itself is not attacking. Use is associated with a specific vitamin deficiency. That deficiency is a documented and completely correctable cause of hair loss, and it is almost never checked at a routine diabetes review because diabetes reviews ask about your blood sugar. So you can have your diabetes managed beautifully for a decade while something perfectly fixable sits untreated right beside it. Stay with me, because that is number one, and by the end you will have one sentence to say at your next appointment that could change what you get out of it. And before anything else, let me be absolutely clear. Nobody stops a diabetes medication because of a video. Not one word of this is permission to do that. I'm Dr. Alan Brooks. I have spent 35 years as a board-certified dermatologist focused on hair and scalp. And more than 10,000 patients have sat across my desk. And people with diabetes are among the patients I find it easiest to help, for a reason that says something uncomfortable about how care is organized. Their condition is monitored constantly, so they have blood tests several times a year. But those tests are looking at one thing, and the space beside it goes unexamined because their diabetes care asks about diabetes, and nobody in that room is thinking about hair. That gap is where I have found more correctable problems than almost anywhere else. This channel is where I say what I never have time to say in a 15-minute visit. Maybe this is you. Your hair started thinning, and you assumed it was age, or genetics, or simply another thing that comes with the diagnosis you already have. You have not mentioned it at a review, because your reviews are about your numbers and your feet and your eyes, and hair feels trivial in that room, and you did not want to waste the appointment on it. I want to say this clearly. It is not trivial, and it is not a waste of the appointment. Your hair is one of the most sensitive tissues you have for reporting on what is happening internally, and in your particular situation, it may be pointing at something worth finding. So let me explain why blood sugar and hair are connected at all, because most people have never been told there is a link before the medication even enters the picture. Your hair follicles are among the most metabolically demanding structures in your entire body. They divide and build constantly, faster than almost any tissue outside your bone marrow. And to do that, they need a steady, reliable delivery of oxygen and nutrients through an extremely fine network of tiny blood vessels. Now, here is what chronically elevated blood sugar does over years. It damages small blood vessels. That is the same process behind the complications you already know about, the ones affecting eyes, kidneys, and nerves. And it is called microvascular damage. Your scalp is served by exactly that kind of fine vessel network. Think of it as the irrigation system in a garden slowly furring up, so less water reaches the plants at the far end of the line. On top of that, elevated blood sugar promotes inflammation throughout the body, and inflammation around a follicle pushes it out of its growth phase early. So before we discuss a single medication, the condition itself has a plausible route to your hair. That matters, because it means good control is not only about your eyes and your kidneys, it is working in your favor up there too. So let us go through the 5 things, counting down. Number 5 is the one people never consider, which is that your blood sugar itself may be the cause rather than any tablet. If your diabetes was poorly controlled for a period, or was undiagnosed for a while before it was found, which is extremely common, then your follicles spent that time in the environment I just described. Reduced delivery through damaged vessels, higher inflammation, and a body under metabolic strain. Hair responds to all of that, usually with diffuse thinning across the whole head, rather than a receding pattern. And here is the practical point I want you to take from this. If your control has improved since then, that environment has improved too, and hair responds to improvement just as it responded to strain, only slowly. The mistake is assuming the medication must be the villain, when in a great many cases the medication is the thing that has been quietly protecting your follicles alongside everything else it protects. Number 4 is rapid weight loss, and this catches an enormous number of people because the timing hides it perfectly. Losing weight quickly, by any method, is one of the most reliable triggers of a condition called telogen effluvium, where a large batch of follicles is pushed into their resting phase all at once. Your body reads a sharp calorie deficit as a shortage, and it makes exactly the decision you would expect. It prioritizes your heart, your brain, and your organs, and cuts spending on the things it considers non-essential. Hair is at the top of that list. Now, here is the part that hides it. Those follicles do not shed immediately. They rest for 2 to 3 months first, and then release together, in a wave. So the shedding arrives in autumn from a change you made in summer, long after you stopped connecting the two, and often at the exact moment when your weight loss is going well and you feel you are finally doing everything right. If you have lost a significant amount of weight in the last 6 months and your hair is coming out, that is very likely what you are looking at. And the reassuring part is that it is temporary and it recovers. What makes it recover faster is keeping your protein intake up while you lose weight, because protein is the material your hair is built from, and it is usually the first thing that drops when people eat less. Now, before we get to the top 3, let me mention something I will come back to properly at the end, because it is the practical thing this whole video is heading towards. Everything here ends in a blood test, and there is a free page that exists to make sure that test actually gets ordered. Number 3 is the newer weight loss and diabetes medications, the GLP-1 drugs, and I want to be careful and accurate here, because this is where the internet is loudest. Hair loss has been reported by people taking these medications, and it is a genuine, frequently described experience rather than something invented. But the most widely accepted explanation among dermatologists is not that these drugs attack the follicle directly. It is that they cause rapid and substantial weight loss, along with a significant reduction in how much people eat, and that combination is precisely the trigger I described a moment ago. So the shedding appears to be largely the weight loss showing up in your hair, arriving on that same 2 to 3 month delay, which gives you something you can actually act on, rather than a reason to panic. Keep your protein intake deliberately high, even though your appetite has collapsed, because on these medications, many people are simply not eating enough of anything, let alone enough protein. Lose the weight at a steadier pace where that is possible, and understand that this type of shedding is temporary and typically recovers once your weight stabilizes. The mistake is stopping a medication that is genuinely helping your health because of a temporary and expected shedding phase. And that decision is not one to make alone. Before I give you the top 2, do something for me. Type in the comments which diabetes medication you take and how long you have been on it. And tell me your age and whether your hair thinning began within a few months of any change. I have a strong suspicion that a good number of you have been on the same medication for many years without ever having the number I am about to describe measured, and I would like to see how many. Number 2 is insulin resistance and the hormonal link, and this one connects to the kind of hair loss most people are actually worried about. Here is the pathway, and it is worth understanding properly. Most of the testosterone circulating in your blood is not free to do anything, because it is bound to a carrier protein called sex hormone binding globulin. Only the unbound portion is biologically active and available to be converted into DHT, the hormone that shrinks genetically sensitive follicles. And research consistently shows that when insulin levels are chronically elevated, which is the defining feature of insulin resistance, your liver produces less of that carrier protein. Less carrier means more free testosterone available for conversion. So insulin resistance is not simply sitting next to pattern hair loss by coincidence. There is a mechanism connecting them, and studies have found associations between early or more severe pattern hair loss and markers of insulin resistance. This matters particularly for women because the same pathway is central to polycystic ovary syndrome, where insulin resistance and elevated androgens travel together and hair thinning is a common feature. And here is the encouraging part. Improving insulin sensitivity, whether through medication, diet, weight, or activity, works on that pathway in the right direction. It is one of the very few things in hair loss where the intervention is good for you, regardless of what happens on your head. And now, number 1, the thing I promised at the start, and in my experience, the most commonly missed correctable cause in this entire group of patients. Long-term metformin use is associated with vitamin B12 deficiency. This is well documented, it is not controversial, and the association becomes more likely the longer you have been taking it and the higher your dose. The mechanism involves metformin interfering with how B12 is absorbed in the intestine. Now, why does that matter so much for your hair? B12 is essential for producing healthy red blood cells, which carry oxygen to your follicles, and for the rapid cell division that hair growth depends on. Deficiency causes diffuse thinning, and it can cause hair to lose pigment prematurely as well. It is one of the most established nutritional causes of hair loss there is, and it is entirely correctable. And here is what makes this so frustrating. B12 is not part of a standard diabetes review. Your appointments check your HbA1c, your kidney function, your cholesterol, your feet, and your eyes. All of that is appropriate and important. But unless somebody specifically thinks of it, your B12 is never measured, and a deficiency that develops slowly over years produces symptoms, tiredness, low mood, brain fog, that look exactly like living with a long-term condition. So it gets absorbed into the background and nobody investigates it. Let me tell you about Robert, 62, a patient of mine who had been on metformin for 9 years, whose diabetes was genuinely well managed, and whose hair had thinned steadily throughout. He had assumed it was age. When I asked whether his B12 had ever been checked, he had no idea, and it turned out it never had. It came back low. We corrected it with his own doctor's supervision, and over the following months his shedding settled. But here is the part that matters more than his hair, and it is why I put this at number 1. Prolonged B12 deficiency can cause nerve symptoms, tingling, and numbness in the hands and feet. And in somebody with diabetes, those symptoms are very easily assumed to be diabetic neuropathy, which is a completely different problem with a completely different treatment. Nerve damage from B12 deficiency can become permanent if it goes on long enough. So this is one of those rare occasions where a question about your hair leads somewhere genuinely important. So here's exactly what to do, and it is 1 sentence at 1 appointment. But before that, let me give you a way to judge how urgent this is for you, because B12 deficiency rarely announces itself as one dramatic symptom, and most people have quietly absorbed several of them into normal life. Think honestly about whether any of these apply. A tiredness that sleep does not fix, tingling, numbness, or a pins and needles feeling in your hands or feet, a sore or unusually smooth red tongue, which is a classic sign almost nobody knows, feeling unsteady on your feet, or noticing your balance is not what it was, brain fog or difficulty finding words, low mood without an obvious reason, pale skin, or breathlessness on mild exertion. None of these prove anything on their own, and every one of them has other explanations, several of which are simply life. But here is why I am listing them. In somebody with diabetes, most of those symptoms get attributed automatically to the diabetes, or to age, or to the medication generally, and the specific, testable, correctable possibility never gets raised. If you recognize 2 or 3 of those alongside your hair thinning, move this appointment up your list. Now the sentence. At your next review, say this: I have been on metformin for several years, and I have noticed hair thinning. Could we check my vitamin B12? That is it. It is a routine, inexpensive test. The association is well recognized, and most clinicians will order it without hesitation once it is mentioned. While you are there, it is also reasonable to ask for your ferritin, which is your stored iron, and your thyroid function, because those are the other two common causes of diffuse shedding, and it makes no sense to correct one while another sits untreated. And ask for the actual numbers rather than the word normal, because with B12 in particular, there is a genuine gray zone at the lower end of the range where some people have symptoms despite being technically within it. 2 practical notes. First, and this is important, do not simply buy a bottle of B12 and start taking it. Not because it is dangerous, but because if you supplement before testing, you can no longer get an accurate reading, and the cause of the deficiency determines the treatment. If your body cannot absorb B12 properly, tablets may not be sufficient, and injections may be needed, and that is a decision that requires knowing your number first. Second, keep your protein intake up, especially if you are losing weight, because that single habit protects you against the shedding described in items 3 and 4. And on that first point, let me give you the practical thing I mentioned earlier. There is a free page called the Blood Worksheet, 10 pages, produced by the written companion guide to this channel. It gives you the standard starting panel for hair loss written exactly as a laboratory orders it, with a line on why each test is there, and it explains why the list deliberately stops where it does, rather than turning a 10-minute appointment into a negotiation about tests. It also gives you the sentence to say out loud so nobody has to improvise while the clock is running. And it carries the warning signs page in full at the front, because that page should never sit behind a payment. For your situation specifically, B12 is the one addition to that list, with a documented reason behind it, so add it. The sheet costs nothing, and there is nothing to buy. You will find it linked in the description below. One thing, doctor to viewer, and it is the most important sentence here. Do not stop, skip, or adjust any diabetes medication because of this video. Metformin and the other medications in this area are protecting you from complications that are considerably more serious than hair loss, and uncontrolled blood sugar damages your eyes, your kidneys, your nerves, and your heart. Every change belongs to the doctor managing your diabetes. Do not start B12 or any other supplement before being tested. And if you have tingling, numbness, or burning in your hands or feet, tell your doctor about it specifically rather than assuming you know what it is, because the cause changes the treatment. I am a doctor, but I am not your doctor. Now, one last honest word. There is a pattern I keep running into on this channel, and this video is the clearest example of it yet. Modern medicine is extremely good at managing the thing it is looking at, and the space immediately beside that thing goes unexamined. Not through anybody's carelessness, but because each appointment has a purpose and a clock. Your diabetes care is doing its job. It was never designed to notice your hair. So the practical consequence is that you are the only person in this story holding the whole picture of yourself. And that means the useful skill is not worrying. It is knowing which single question to ask and asking it. In your case, that question is 9 words long. Could we check my vitamin B12? Expect any shedding to settle within a couple of months of correcting whatever turns out to be low, and real density to follow between month 6 and month 12, because hair always lags behind blood work. And ask the question even if your hair were not the reason, because as I said, this one leads somewhere that matters more than hair. So take that sentence to your next appointment, and come back and tell me in the comments what your number turned out to be, and whether anyone had ever checked it before. Type your age too. I read every single one. Take care of yourself. I will see you in the next one.